Professional Role Presentation, Nurse Practitioner, presented by Erin Dennis and Taylor Blaine. Introduction.
Nurse practitioners are advanced practice registered nurses who provide care to patients throughout the lifespan, from premature newborns to the elderly.
NPs can prescribe medications including controlled substances in all 50 states. In 26 states, NPs have authority to practice independently.
Current status.
1,670 females, 139 males, 1,397 unspecified, and 3,206 total.
Only 9.1% of all RNs are under the age of 30. The average age of RN population in the United States is 45.2 years.
Approximately 87% of all RNs are Caucasian, 4.9% are African American, 3.7% are Asian or Pacific Islander, 2% are Hispanic, 0.5% are American Indian or Alaska Native, and 1.2% categorize themselves as multiracial.
In 2013, nurse practitioners made a median salary of $92,670. The highest paid 10% earned $126,250, and the lowest paid 10% earned $66,960.
Practice setting and patient population.
Practice settings would be private practices, community clinics, hospitals, school-based clinics, correctional facilities, nursing homes, health maintenance organizations, Armed Forces and Veterans Administration facilities, and urgent care settings.
The majority of NPs have been credentialed and practice in the family or adult patient population, and many have practice privileges in hospitals or long-term care facilities.
Education required.
Education for a nurse practitioner can vary. You can get a Master's of Science in Nursing or a Doctor of Nursing Practice. The Master's is an education program that takes 2 to 3 years to complete, and graduates are eligible to seek professional certification. The Doctor of Nursing Practice is completed after the Master's, and students may opt to complete a doctoral degree program to further enhance their career and opportunities.
Licensure. Obtaining licensure as a registered nurse, you do that through the National Counselor Licensure Examination. Registered nurses take the NCLEX RN. This is required. It's a required nurse prerequisite to becoming an NP. Also, passing the NCLEX proves that RNs have the necessary skills to work in the field. Nurse practitioner credentialing. After completing master's degree programs, graduates are eligible to obtain professional certifications as NPs. Programs for this would be the American Academy of Nurse Practitioners and the American Nurse Credentialing Center.
Responsibilities.
The roles of a nurse practitioner include working directly with patients. Nurse practitioners can diagnose and manage most common and many chronic illnesses. They authorize to perform physical examinations, order and interpret diagnostic tests, provide counseling and education, and write prescriptions.
Their approach makes them unique. Nurse practitioners can use an approach that is nurse-based, focusing on the patient and his and her environment as a whole. Nurse practitioners not only diagnose problems and treat those problems, but they incorporate the treatment and the response into their family, their culture, their daily lives, and their community. The skills they have are advanced practice skills, time management and organizational skills, collaboration and teamwork skills, and interpersonal skills.
Leadership.
The National Organization of Nurse Practitioner Facilities, or NONPF, is the only organization specifically devoted to promoting quality nurse practitioner education at the national and international levels.
Starting in 1974 as a small group of educators meeting to develop the first NP curriculum guidelines, NONPF has evolved as the leading organization for nurse practitioner faculty sharing the commitment of excellence in NP education.
Current legislation and reimbursement.
State practice. State practice and licensure law reduces the ability of nurse practitioners to engage in at least one element of NP practice. State requires a regulated collaborative agreement with an outside health discipline in order for the NP to provide patient care.
Reimbursement includes Medicare reimbursement, or others, which is now based on patient satisfaction and quality of care.
Patient advocacy.
Advocacy involves the process of persuading someone to at least consider one's point of view. The role of a nurse as an advocate in healthcare policy is not a new one.
Nurses are well-informed and well-educated, and they are passionate about the well-being of their patients. All of these factors drive them to advocate for their patients.
When a nurse takes on public health advocacy roles, it benefits the profession too.
Specialty organizations.
American Association of Nurse Practitioners.
Conclusion.
Overall, we believe that nurse practitioners play a very important role in society, due to the fact that they can prescribe medications and give nurses a respected reputation.
Their roles are very beneficial to society due to the fact that their ability to care is a wide range and can play many roles as a caregiver. Thanks for watching this presentation.
On Nurse Practitioners, I'm Erin Dennis,
And I'm Taylor Blaine.
and we're checking out.